Well, hello there. How's it going? Good evening. And welcome to another live stream. I did say the other day, didn't I, that I wouldn't be doing any more Lucy Letby stuff, but I've gone through some of the Dr Marnerides stuff and I've realised that he covers all the cases where the children died, so I thought maybe it would be a good idea to look at both not the prosecution, but the expert evidence in terms of his evidence in chief, and then also his cross-examination, where he's cross-examined by Lucy Letby's defence barrister, Benjamin Myers KC. And he actually deals with each case specifically, or separately, I should say. So that's what we're going to be dealing with, and tonight we will start with the case of Child C. But before we do that, let's just say hello to a few people in the chat. First of all, a big thank you to Euphemia Grub, who has become a YouTube member. Thank you very much for doing that. Greatly appreciated. Penny, welcome to you. Lenny Russell, welcome, welcome. Glad you could be here this evening. Jean Ann, welcome. Mish, welcome to you. Thanks for joining us. Brum Vixen, welcome. Athena, welcome to you. Thanks for joining us. And before we actually get into this, we'll also cover a little bit of Dr Marnerides' background, because he did give that background to the court. So I thought we'll include that before we get into the actual evidence in terms of his evidence in chief and also the cross-examination. So we should have about 30 pages or so to get through. So yeah. What I'll do probably for the next episode, though, in terms of Child C, which is the next case, I may actually play possibly the prosecution closing speech, or just something to give it a little bit of context before we get into that case. I mean, I've missed a trick there. I should have done that for this one, but sadly, I don't have enough time this evening to find that part of the video. I might have, but actually, just bear with me a second and let me just see how quickly I can find this part of the video. If I can't find it in a couple of minutes, then I'll just I'll leave that for this evening. But just give me a couple of minutes and see if I can pull it up on a specific video. Just bear with me. First of all, I need to find the video. That would help. So give me a second. Because with this stuff, you know, reading out the expert evidence, it's always good to have at least some sort of context, whether that's from the prosecution or the defence. It's always good to have a little bit of background concerning the case in question. But do I have it to hand? That is the question, isn't it? Let me just have a little browse on the old desktop a second. And see if I've got it somewhere. Bear with me. Let me have a look in the downloads folder, see if it's in there. Right, bear with me. Right, let's see what this is. The issue I've got is that I've got her cross-examination for the case of Child A, but it's going to take me a while to find... It's going to take me a while to find the closing speech because I haven't got timestamps on it and it's about 7 hours long, so it might take me a while to go through it. Maybe if I just play the cross-examination, maybe that'll be better. Just bear with me. Sorry about this, guys. I'm a little bit unprepared, it would appear. Usually I've got everything sorted out, you know, but I do think it's better to just try and provide a little bit of context, you know, with these cases. So if I can find her cross-examination, maybe. Just give me a second. Right, so this one's 1 hour and 19 to 125. So it's about 30 minutes. Right, okay. Right, okay. So now I've got, excuse me, now I've got to find this video. So just give me a second. The evidence against Lucy Letby, official transcripts with chapters. Official transcripts. Part 2. With chapters. Right, here we go. Okay. Right, so if I move this over here and then try and open it up on here.
In this video, and
okay. And then try and find, what was it again? 119.22 or thereabouts. Right, okay. Right, okay. So what we'll do then, just to provide a little bit of context regarding this specific case, is we'll go through her cross-examination regarding the case of child A. Then we'll take a brief look at Dr Marnerides' background, and again, he's the forensic pathologist. We'll then move on to his evidence in chief, and then also his cross-examination where he's asked questions by the defence barrister Benjamin Myers KC. And again, this is all from the official transcripts, the official court transcripts, purchased and paid for by my good self. And if you do wish to support the channel in any way, shape or form, you can find out how to do that down in the video description box below. All help is greatly appreciated. And as I say that, we seem to have a bit of competition brewing in the chat. We've got Valor Hawks, who has popped in with the $23.99 super chat.
oh my God!
And Lenny Russell with the 10 gifted crime scene to courtroom memberships. Let me just see who's received these. Is it Leslie? That's the question. It's Brummy Vixen. It's Gina Aldrich, GR, Crime Girl 420, Gina, Gary, is that, I think? Grateful, Mel Raz, Michelle E, Anne Christiansen, but not Leslie. Oh dear, that's not going to go down well, is it? But thank you so much for your support, both of you, both to Valor Hawks with the kind $23.99 super chat, and also Lenny Russell again for his 10 gifted crime scene to courtroom memberships. That's incredibly generous. So as I say, just to clarify, we're going to go through Lucy Letby's cross-examination concerning child A. Then we'll take a look at the background in terms of the forensic pathologist Dr Marnerides. Then we'll go through his evidence in chief concerning child A and his findings. And then we'll take a look at a cross-examination conducted by Lucy Letby's barrister Benjamin Myers KC. So hopefully we're going to have, you know, his evidence in chief followed by the defence. So we'll have 50% of his evidence in chief, and then that's countered, obviously, by the cross-examination of Lucy Letby's defence barrister, or by Lucy Letby's defence barrister. So hopefully we're providing a fairly balanced viewpoint, you would hope. That's the hope, anyway. That's the aim. But again, thank you so much for that, you two. That is greatly, greatly appreciated. Right, so I'm going to play this video now. And again, this is just to give you a little bit of context concerning the case of child A. And then we'll get straight into the background to Dr Marnerides. Let me create a banner for this very quickly. Just 2 seconds. Examination. Lucy Letby cross-examination child A. Right, okay. Right. Now I'm going to mess this up, aren't I? I should know how to say this because there's a podcast that I listen to, or did listen to in the past, that has someone with that same name. Is it Anya? Am I right with that? Anya? I don't know why my pronunciation seems to be so bad on these live streams, but I think it's Anya, hopefully. Let's hope. Right, and I'll say hello to you all once we finish this video, but let's get on with this particular video. Let's get this out of the way, and we will continue onwards after this video with the background, as I say, to Dr Marnerides. With the case of child A, please. You were first interviewed on the 4th of July 2018. Independently of the medical notes, did you have any memory of child A? Yes. Just for anyone's note, it is of course count 1. He was born on the 7th of June and died a day later on the 8th. He was, as we all know, the twin of child B. Before child A, had you ever known a child to die unexpectedly within about 24 hours of birth? I can't comment on that. I'm not sure. Or how many infant deaths had you witnessed in your employment before child A? Not many, maybe 2 or 3 at the Countess, and then several more of my placements at Liverpool Women's. 2 more at Liverpool Women's. You say several more. I'm offering an alternative of 2 more. I can't say. I don't keep track of numbers. I'm just going off what you said to the police, you see. Well, my memory would have been clearer then than it is now. Okay. Well, we can go to the interviews if you'd like to check it. Page 16 of your child A interview. I'm suggesting that you told the police that you'd seen 2 at Liverpool. Okay. When child A and child B were born, were the staff, including the nursing staff, talking about their mother's antiphospholipid syndrome? Not at the time. When I was looking after child A? At any time? You tell us. Well, the first time I met child A and was on shift was the day of the event. Afterwards, the condition was talked about, yes. Was it being offered up as an explanation for what had happened, as far as you were aware? It was possibly a contributing factor. That was what was being discussed at the time. But we know now that it wasn't, don't we? Yes. Is it your case that the staffing levels in the Countess of Chester Hospital contributed to child A's death? In part, yes. Right. How? Through the amount of time that he was without fluids for, and the issues around the lines insertion. Right. So he was without fluids from sometime about 4 p.m. or thereabouts, 3 or 4 p.m. Yes. So your case is what? That he died from dehydration? No, I'm saying that they're contributing factors. But according to you, at least, how did that lack of fluids for about 4 hours contribute to his death? What's your case? They would have put him at an increased risk of collapse, and he would have had less reserves to then fight off any infection or any procedures that we were doing. So it's your case that 4 hours without fluids killed child A? No, that's not what I'm saying. No. What? Oh, I can't tell you how child A died. I don't know. Okay. Is it your case that the competence of the medical staff contributed to child A's death? Again, I can't say definitively how child A died, but yes, I think the issues around the lines made him more vulnerable, yes. And what issues around his lines made him more vulnerable? That he was left with a line in situ, a UVC that was not for use and was due to be removed and it wasn't. And then having a long line sighted and time passing by without that line being connected to anything and being confirmed on X-ray. It's not usual practice. All right. Did you fill in a datix? No. Why not? Just haven't. You fill in a lot of datix forms, don't you? Yes. 3 at the end of June 2016. Right. We'll come to them, but 2 of which contained lies, according to Dr Breary. Yes? According to Dr Breary. If you seriously thought that child A's death was contributed to by him not having fluids for any significant period of time, why didn't you fill in a datix form? It was discussed amongst staff. We all talked about that as contributing factors at the time. That was readily discussed amongst staff, including the consultant. No. The question is, why did you... I didn't feel I needed to do a datix. It had been raised verbally by senior staff, 2 senior staff. And those senior staff were who? Ravi Jairam and other members of the nursing team. No, Ravi Jairam and... I didn't say 2 senior staff. I escalated the concerns to senior staff, and one being Ravi Jairam, the other senior nursing staff. And part of that discussion is why we then kept the fluids and the line from child A. I'll come to that in a moment, if I may. Was child A's death anything to do with Mel Taylor? I don't know why child A died. But I'm asking you whether it's your case. Does it have anything to do with Mel Taylor? If we agree that the cause of death was an air embolus, then I believe she attached fluids to those lines, yes. So that's Mel Taylor's fault? Yes, if that's what we agree, that child A died from that, then yes. Because you weren't standing over him at the time he collapsed? No, I did not have any access to his lines, so therefore if an embolism came, it must have come from the person connecting the fluids, which is not me. Would you admit it if you did? Did what? Put air into him? I haven't put air in, so I'm not going to. The question is, would you admit it if you did? It's not something I would ever do. I'm going to ask you about some of the descriptions that have been given by your colleagues in evidence about child A to see whether you agree or disagree with them, all right? Okay. Starting with Dr. Beach's evidence, on the 7th of June, Dr. Beach told the jury that child A was doing well, that he was crying and vigorous on stimulation shortly after his birth at about 9 p.m. Do you disagree with that? No, I wasn't present for that, so... The following day, the day he died, which was Monday the 8th of June, at 9:45, Dr. Ogden at tile 84 described child A as handling well. Do you disagree with that? Again, I wasn't there, so I can't comment. That's her opinion. Well, are you aware of anything to contradict Dr. Ogden's opinion? No. And as you've already told us, in the afternoon there were problems identified with the UVC, and then the cannula to which he was attached became blocked. Yes. Do you remember that at 1900 hours on the 8th of June, Dr. Harkness put a central line into child A? I know that happened, yes. Do you accept that you were standing over child A at the time he collapsed? I accept I was within his cot space checking equipment, yes. How close were you to him at the time he collapsed? I was in the close vicinity. I was checking the equipment around his incubator. Yes. Give us an idea in terms of this court. Could you reach out and touch him? I could touch the incubator, not... I'd have to open the doors to actually get into the baby, but yes, I could touch the outside of the incubator. Could you touch the lines? No. Why not? The incubator was closed. Do you accept that at the time child A collapsed, Mel Taylor was on the computer doing her nursing notes? Yes. It's your case, and correct me if I've misunderstood, that Mel Taylor was the sterile nurse in terms of attaching child A's line? Yes. Do you accept that it was at 20:05 hours that the bag was hung? Yes. Do you accept that you co-signed for that? Yes. And do you accept that the order of the signatures doesn't illuminate the question of who it was that actually hung the bag? That's correct. There's no way of knowing from signatures. It was 15 minutes later, wasn't it, that child A collapsed at 20:20? Yes. And what I'm going to do is to remind you of various people's descriptions of what they saw, okay? What I'm going to ask you is whether you agree or disagree with their descriptions. Okay. Do you understand? Yes. So if you want me to repeat any of this, you say so, all right? Okay. I'm quoting from the transcript, and I'm going to start with Dr. Harkness. For your lordship's note, this is day 12, pages 90 to 92. What Dr. Harkness said was this: there was a very unusual patchiness of the skin, which I had never seen before, and I have only seen in cases since within the Countess of Chester Hospital, and nothing other than that. I'm not asking you to comment on what he has or hasn't seen, but do you agree with his description that there was a very unusual patchiness of his skin? No. There were patches of a kind of blue-purple colour. There were patches of bright red colour. There were white patches, and they didn't fit with something that you would find on a baby that's not pumping any blood around their body. Do you agree with that? No. This had bright red patches, which does not fit because red patches means you've got blood going round your body. Do you agree with that? No. It had purple patches. It had white patches. I agree with that. Yes, he had mottling. No red marks? No. No red blotchiness? Sitting here now, I can't recall any blotchiness, no. Are you saying Dr. Harkness has made that up? I didn't see it. If he saw something that I didn't, that's something he has to justify. That's not quite the question, you see. I'm asking whether you dispute something. If you can't comment, then that's one thing. But you say, no. I said, is that right? No. It's not something I saw. I'll come to what you saw. The question is, are you disputing what Dr. Harkness says he saw? Yes. Why? Because I was present and I didn't see those. Right. So because you didn't see it, you are disputing it. Yes. Dr. J-Ram, this was his description, and this was on day 14, page 126. He was very pale. What I really didn't give any clinical significance to at the time was sort of unusual patchiness of discoloration. Do you agree with that? I don't agree with the discoloration. I agree he was pale. It's interesting because it's the first time I've seen that. Child A was very pale to blue. Do you agree with the pale to blue? He was pale. I don't recall him being completely blue, no. But they were unusual. The best way to describe them is pink patches that appeared mainly on the torso, which seemed to sort of appear and disappear and flit around. Do you agree with that? No, I don't. Nurse A, your friend. She was your friend, wasn't she? Yes. A good friend? Yes. Do you trust Nurse A? As a colleague or as a friend? Both? Yes. What she said, how many years' experience did Nurse A have? Well, I don't know exact figures, but she was very experienced. Approximately 20 years? Possibly, yes. Is she the sort of person you would defer to? Whose advice you would take? Yes. If you had a problem, is she the sort of person that could be relied on to give you a good solution? Yes. What she said is this. I'd never seen a baby look that way before. I mean, he looked very ill. Did he look very ill? Yes. He had a discoloration pattern that I've never seen before. Was this a discoloration pattern that you had ever seen before? I didn't see a discoloration pattern. So you don't agree with that? No. He was very white with sort of purpley blotches. Do you agree with that? I agree that he was white with purple markings that looked like mottling, yes. He did look cyanotic as well, but it was this purpley blotchiness with white that I'd not seen before. Do you agree with that? No. She's not describing there, is she? The common or garden blotchiness that babies have on neonatal units? No. Because she's never seen it before, with all that experience. Do you agree with that? That's what she said, yes. My recollection, it was all over him, everywhere, maybe more torso, and I can't remember clearly, but unusual. It had come on very suddenly. Do you agree with that? I agree that the colour change came on very suddenly, yes. Let's go to what you said, bearing in mind that you don't accept the red marks. Can we go to your interview, please? It's in the first interview bundle. It's the very first of the interviews, so it's child A number 1. If you just turn back a page from where you are, if you wouldn't mind, we'll just do the formalities. We can see here that the date of this interview was the 4th of July 2018, CB1. Have you got that? Yes. The time that the interview commenced was 10:23. It concluded at 12:04. Let's go to page 8 and get your description, please. You are being asked to describe what you saw. Is that right? Yes, I'm asked to interpret what pale is. Yes. Yes. So the second question on the page, you're asked the following question. Tell me how you interpret pale, first of all, in a neonatal baby. You replied, so it's a loss of colour. Babies are usually quite pink and he'd become more pale, as in almost white. And you make it clear that that means there's something wrong. It could be infection, could be hypoglycemia, when they've had a sudden collapse. Then you were asked the following question, and mottled the same thing. How do you interpret the mottled appearance? To which you replied, mottled is a bit more of almost like a rash appearance, like blotchy red marks on the skin. Is that what you were referring to as mottled? Yes. Then further down the page you say the following. So when the baby's quite pale and white, they can have sort of red areas on them. Red. Is that right? Yes, this is all in relation to mottling, yes. And you reply over the page, yeah, like reddy purple. Yes. You say he was centrally pale. Yes. Then if we go to page 11, please, halfway down the page you're being asked about the time child A collapsed. It's pretty much exactly halfway. You say the following. I believe I was checking the equipment, yes, at his cot side and his charts. Is that right? Yes. Then the police officer asked you this. When you talk about this mottled rash, can you give us any further description of how it showed? Shape? So what you're being asked here is, what did you see, aren't you? Yes. You're not being asked about your description of mottling. You're being asked a specific question, what did you see? Do you agree? In relation to the mottling, yes. No, in relation to what you saw on child A. Well, when you talk about this mottled rash, yes, that's what I'm referring to. I'm paraphrasing it, but what the police are saying to you here is, you said he had a mottled rash. Yes. What did you see? Yes. What are you saying is a mottled rash? Yes? Yes. Do you agree? Fair? Yes. So that's the question you were asked. Can you give us any further description of it, how it showed, shape? You replied, I think from memory it was more on the side that had his line in. Is that right? Yes, I remember the paleness and discoloration was more to the left-hand side, yes. You were then asked the following question. Which side was that? Do you remember? And you said, as you just have, I think it was his left. You were then asked, and you described it as a red-purple colour. Can you sort of help us with any comparisons with anything colour-wise, the way it showed? Was it bright red? Was it dark red? And you replied, I think he was more pale than the mottling, than the little areas of the mottling. Yes. Were you not describing blotchy red marks on his skin? I was referring to mottling. That's how I would describe mottling, and I also felt he was more pale than mottled. So is it your evidence, just so that we understand where the lines between the prosecution and you are, is it your evidence there was nothing unusual to be seen on child A? No, it's unusual to have a baby that is pale when he was particularly white on one side. That is unusual. So far as the discoloration was concerned, is it your case that there was nothing unusual about the discoloration? I don't recall there being an abnormal discoloration, no. So that's your case? Yes. So far as the testing of the bag was concerned, which you mentioned earlier, I think Nurse A accepted that you had asked for the bag to be tested, as you said in interview. Yes. Was it tested? I don't know. I put it aside and labelled it. The responsibility then went to the shift leader of the next shift. Did you ever follow it up? I can't say. I can't recall specifically, no. I know I labelled the bag and I put the request in the diary and I handed it over to the shift leader. Right. Further evidence that was given by those who tried to save child A, Dr. Harkness. Do you remember him telling the jury how he bagged child A? I can't recall that now, but yes, if that's what he said. And he said that child A's chest was rising and falling, that his heart rate and his saturations were declining. Do you remember that? Yes, well, not specifically. I'm relying that that's what he said. I can't recall everybody's evidence in detail. Sure. I'm sure I'll be corrected if I'm misrepresenting what people have said. Do you accept, given that pattern of air going in and out, the sats and the heart rate falling, that this wasn't a normal respiratory problem that child A had? I don't think I can comment on what condition child A had at that point. I'm not asking you for a diagnosis. What I'm asking you to give us is your point of view about this issue of air going in and out, and the heart rate falling and the saturations falling. So the evidence is that air is going in, carbon dioxide is going out with more air, but more carbon dioxide. And yet child A's heart rate and saturation rate were falling. And that is not a normal respiratory problem, is it? No, generally if you've got an airway and you've got chest movement, you would expect to see a rise in observations, yes. Exactly. Dr. J-Ram dealt with a number of other issues, which I'm asking for your comment on because you were there. He said that the heart rate on the Philips monitor was normal. Do you agree? I can't recall specific values now. But if there had been something abnormal, would you have taken any notice of it? His monitor did alarm. That was how we were alerted to him having a desaturation, so he must have had a change in observations. Yes. The trace, do you remember the P waves and the something else waves that he gave us a little tutorial about? Do you remember that bit of evidence? Yes. He said the trace of the heart was normal. I can't comment on that. That's not something that nursing staff could interpret. Have you ever seen an arrhythmia in a neonate? No, I don't think so. No. Dr. J-Ram said that child A's heart was pumping normally. Do you disagree with that? That's his opinion. I don't feel I can assess that. You don't contradict it? No. Dr. Marnerides found an air bubble in child A's brain and in his lung. Did you inject child A with air? No. Dr. Arthurs found air bubbles in his great vessels. Do you remember that? Yes. Just like child D and child O. Yes. That's because you injected him with air, isn't it? No. After this, did you want to get straight back into nursery 1? Yes. Why? From my experience at Liverpool Women's, you're actively encouraged that if you've lost a baby in a certain cot space, that you go straight back into that nursery and care for other babies so that you sort of move on from that first experience, and it doesn't almost prevent you from going back into the intensive care environment. Did you tell the truth to the police? In what respect? Yes, I have told the truth. Can we just go over your second interview, please? Right at the end, it's CB 27. You're asked about the dangers of air going into the circulation. Yes. And you're asked about what the dangers are. And you said, I don't know what it would cause. Is that true? Yes, I don't know the pathological reasons that it would. I know ultimately it would end in death, yes. Anything between that, I don't know. And the question was what? What are the dangers? You have just told us death. Why didn't you give that answer? I can't answer that. Were you playing daft? No, it's something that every nurse would know. Oh yes, absolutely. So why didn't you say so? I've also said that I don't know exactly how it would affect a baby, and that's true. I know the ultimate in anything that you do, the ultimate serious outcome, could be death. What that would look at, what that would appear as in the symptoms of the baby, I don't know. Right, so let me just make sure that's all of it. 141.49, bear with me. 141, yeah, so that's moving on to child B. So that's child A complete in terms of providing a little bit of context for this particular case. So, I'm just going to check the chat briefly, and then we're going to take a look at Dr. Marnerides, the forensic pathologist, and his evidence regarding this specific case. And then also his cross-examination, which took place by Lucy Letby's defence barrister, Benjamin Myers. So we'll take a look at both sides of the coin, if you will. Right, okay. Right then, so let's just give you a little bit of background concerning the forensic pathologist, Dr. Marnerides. So first of all, let's put the correct banner up. That would be helpful, wouldn't it? There we go. Okay. So, Dr. Marnerides' background. So this is Nicholas Johnson KC asking questions of Dr. Marnerides. So could we start by you telling the jury who you are, please? He replies, yes, I am Dr. Andreas Marnerides, and I'm a consultant perinatal and paediatric pathologist based at St Thomas Hospital in London. Thank you, that's a bit of a mouthful. Could you just explain? I'll come to your qualifications in a moment, Doctor. But could you explain to the jury what your day-to-day work involves, please? He replies, so a pathologist is a medical doctor that is trained in a specialty called pathology. That's a specialty that means basically two things of expertise. One is interpreting specimens from the living, biopsies that you may have heard. So if somebody had an operation, they're being investigated for a tumour or any other disease, the pathologist will look at that specimen under the microscope and help the clinicians make the diagnosis. The other part of their expertise is when they perform post-mortem examinations, so people that have died. A perinatal and paediatric pathologist has the subspecialty of dealing with the paediatric population. The term perinatal refers to the time around a woman's pregnancy and the early time after the baby's delivered. So the perinatal pathologist has the expertise in examining the placentas in case there is a need for examination. Fetuses that have died in utero, so before they were born, babies that are born alive and die very early in the neonatal period. And of course, the paediatric, you can understand, is every age of a child. Then Mr. Johnson, thank you. In terms of your workload, doctor, how many cases of perinatal and paediatric people do you deal with a year? He replies, so in terms of post-mortem examinations, at my department we do roughly 750 post-mortem perinatal paediatric examinations. This includes both cases that are those that are called hospital cases. The doctors and the parents want to investigate further what has happened in the pregnancy or why there was a stillborn baby or the baby died early in their life. There is no coronial, so no judge involved and no police involvement. But we also do, which is a big number, around half of these cases, the 750, are medico-legal cases. So there is a coronial request or a police request. I'm dealing with 99% of those requests that have come through the police. So the forensic cases where there's a suspected crime being investigated. It's 3 pathologists that do the 750, 3 consultant pathologists. So I would be roughly doing 1/3. And on Fridays, we go through the cases that we have seen and discuss all the cases. So even if one has not done the post-mortem examination, one has the experience of what the other colleagues have seen in that post-mortem examination. What were the findings? And then there is a discussion around that. So your figure of 750, is that a year? He replies, yes, that's a year. Okay, in very round terms, about 2 a day in very round terms. He replies, yes. Yes, thank you. All right, so that's your day-to-day working life. Could we deal with your qualifications, please? Can we take these reasonably slowly, please? He replies, yes. So I have a medical degree from the Medical School of University of Athens in Greece. In what year did you get your medical degree? He replies, 2002. So 21 years ago. He replies, yes. Then I proceeded with training. In Greece, it's called forensic medicine. It's the equivalent of forensic pathology in the United Kingdom. I did a PhD as well in pathology. I studied the function of Hodgkin's lymphoma, which is a hematological malignancy, so a tumour of the blood in very simple terms. Then I proceeded and I went to the Karolinska Institute in Stockholm and did my training in paediatric and perinatal pathology. I joined St Thomas Hospital as a consultant perinatal and paediatric pathologist in January 2013, having worked for approximately a year as a consultant before that in Sweden. And since then, I'm based at the St Thomas. Since 2013, I'm based at St Thomas. The everyday work is what I've described before that. I became a fellow of the Royal College of Pathologists, I think it was 2021, and I also hold a diploma of medical jurisprudence, which is from the Royal Society of... Right, I've got to find out how to pronounce this. 2 seconds. Apothecaries. The Royal Society of Apothecaries in London, which is specialising in forensic pathology. So back to Mr. Johnson. For anyone that doesn't know St Thomas Hospital in London, is that one of the main teaching hospitals in the capital? He replies, yes. Right, so that's the end of the introduction in terms of Dr. Marnerides. Okay, let's just catch up with the chat and then we'll move on to his evidence in chief. Right. Okay, so again, now he's being asked questions again by Nicholas Johnson, and this is focusing solely on the case of child A, or baby A. So, I don't know why I've highlighted that by accident, that's a bit silly. So, question, could we move then please to your reports on child A? So far as child A's case was concerned, were you initially approached by Cheshire Police late in 2017? He replies, that's correct. Was the first report that you wrote dated the 21st of January 2019? He replies, that's correct, yes. Were you provided further material in 2021, which I will list in a moment? And did you write a statement confirming what it was you had received? He replies, that's correct. That's the 20th of October 2021. Then finally, did you write a very short statement dated the 5th of September 2022 dealing with some further information that you had received from the police? He replies, that's correct. I'd like, if you would please, for us to use your first report as the basis for your evidence to the jury. So the report dated the 21st of January 2019. Were you told, and did you reproduce in your report, the fact that child A was born on the 7th of June 2015 at 20:31 hours? He replies, yes, that was the information received, yes. And that he died the following day at 20:58 hours? He replies, yes. His gestational age at birth was 31 plus 2. He replies, that's correct. His weight, 1,660 grams. He replies, that's correct. So far as the material that you received from the police was concerned, did you list that in your report? He replies, I did. The initial material you received, did it include a witness statement made by Dr Evans dated the 31st of May 2018? He replies, that's correct. A 331-page PDF document, which was in effect medical records from the Countess of Chester Hospital? He replies, that's correct. And then quite a lot of photographs that were taken by the pathologist Dr Shuckler at the post-mortem examination. So Dr Shuckler, if I'm pronouncing that correctly, I believe that was the individual who did the original post-mortem. He replies, that's correct. A list of the photographs can be provided, but in essence, were you given or shown the photographs that Dr Shuckler took at that examination? He replies, yes. Did you also receive 78 pages of paperwork relating to Dr Shuckler's examination? Yes. The coroner's records, which ran to 100 pages? Yes. And also 25 histology slides that have been compiled consequent on the initial post-mortem examination? Yes. Together with 23 paraffin blocks? He replies, yes. What is a paraffin block in this context? He replies, you'll remember when I said a piece of tissue is put in a cassette and it's transferred to the lab. When they take the very thin sections and stain them, the tissue that is left from the thin section is retained in the lab in the form of a paraffin block. And people can go back if they see something, and if they need to go deeper into the tissue, or they need to do further tests, further stains, specific stains, they can always use those blocks. So that's standard practice. Mr. Johnson, later on, and I'm just looking at your report of the 20th of October 2021, did you receive another complete set of medical records for child A? He replies, I did, yes. Did you receive the report of Professor Arthur's dated the 19th of May 2020? Yes. The report of Dr Bowen dated the 12th of December 2020? Yes. 4 further statements made by Dr Evans dated the 7th of November 2017, the 24th of March 2019, the 24th of June 2021, and the 31st of May 2018. He replies, that's correct. A statement made by Professor Sally Kinsey dated the 4th of March 2020. He replies, yes. 2 further statements made by Professor Arthurs dated the 19th of May 2020 and the 25th of January 2021. He replies, yes. Then a series of 8 further statements made by Dr Bowen, all dated in 2021. Various dates in April, June, July, and indeed January 2021. He replies, yes, that's correct. Thank you. I want to go to the relevant findings, or the findings that are relevant to your instructions and your response. My lord, I won't take long in doing this, but I would just like to go through some of this material just to remind the jury of the context of Child A's case. And then the judge, Mr. Justice Goss, says, I was going to suggest that we did that in any event because it's a long time ago when we heard this evidence. We've heard an awful lot of other evidence since then. So let's just cast our minds back to Child A's case. Right, so I'll stop there for a second and just catch up with the chat and stretch my legs. Oh my God. Ooh. Right, there we go. Lady Wins 1, hello from Australia. I seem to get quite a few Australian viewers, or couple, I should say. I finally made it to a live. Thank you for bringing us the facts. You're welcome. You are more than welcome. And as I say, I've got 2 full days worth of Dr Marnerides where he goes through all the deaths and his reports regarding each of those cases. So I think it's worth putting out there, you know, what he suggested the cause of death was for each of the children. But also, in fairness, I'm also including, I should say, his cross-examination. So this is his evidence in chief, but then we're also going to take a look at what happened when he was cross-examined by Lucy Letby's barrister, Benjamin Myers. So we'll take a look at both sides of it, basically. Right, okay. So, Mr. Johnson, thank you. If Mr. Murphy would help, please, by putting up the sequence for Child A, please, starting with Tile 3. Do we see that Child A was born on 7th of June at 2031? If we click on the tile, please, we see the APGAR scores there for Child A. Did you record, Dr. Marnerides, the fact that Child A's mum had a known history of antiphospholipid syndrome and had been on long-term warfarin treatment because of the risk of blood clots, which was subsequently changed to a combination of different drugs, including aspirin? He replies, yes, I recorded that. Child A was born by C-section, as we can see recorded on that slide. His birth weight was, as you have already told us, again recorded on that slide, and he was in poor condition initially, but became stable following resuscitation. It says minimal spontaneous respiratory effort, albeit he has good tone, blue-pink. I think you refer to CPAP in your report, but you have revisited the records in this respect. Is that right, Dr. Marnerides? He replies, that's correct, yes. If we look at tile 84, for example, we can see that by the following morning, Child A was on CPAP, yes, and that's continued, as we could see from tile 172, if anybody wanted to check that, at 8 PM that night. If we can go to tile 134 next, please, if we click on that, we can see here that the position of a UVC was being reported on by Dr. McCarrick from an X-ray at 14:28 on the afternoon of June 8th. And we know, as a matter of fact, that that UVC was removed because it ended up in the portal vein. I think you refer to that in your report, don't you? He replies, yes. The portal vein, just to remind us, is where? He replies, it's in the liver. Thank you. Was a second UVC inserted into Child A's belly button at 16:30, into the umbilicus, and that also ended up in the portal vein? He replies, yes. If we go to tile 154, please, do you refer next to the fact that Dr. Harkness inserted a long line via the left antecubital fossa? Hopefully that's right, I think it is. And that's at 1900 hours. He replies, yes. Do you refer next to what is our tile 185, which is Child A's sudden deterioration at 2026 hours on the 8th of June? And do you refer in your report to the attendance of Dr. Jayram, who noted the absence of respiratory effort or heart sounds or pulse, that resuscitation was futile, and that was discontinued at 2058, which we can see on tile 221. I think you record the fact that Dr. Harkness had removed the long line following child A's collapse, albeit the UVC was still in place. Is that right? He replies, that's correct, yes. Did you refer next to Dr. J. Ram's description of discoloration, which had been observed on child A? He replies, yes. To remind us, we heard the evidence on Monday the 24th of October last year. Did you turn then, Dr. Marnerides, to Dr. Shukla's findings at the post-mortem examination? He replies, I did. We've seen those summarised in the agreed facts that we've already run through. Did you also summarise Dr. Evans' witness statement? I did. Which in effect reviewed the medical records. He replies, that's correct. Thank you. I'd like to go to your paragraph 15, please. Having reviewed all that material, having reviewed the physical findings of Dr. Shukla, and having looked at the slides, the histology slides of tissue taken from child A, did you find anything unusual? He replies, yes. Let's take this slowly, if we can, please. From what part of the body, first of all, was the first unusual thing that you found? He replies, the first unusual finding was from the lungs, and I observed that on histology, so by looking at the sections under the microscope. So this is meat and drink and daily language to you, but the sections are the very thin slices, is that right? Yes, taken from the samples of tissue from the lungs. He replies, yes. Right, stop there for a second. Have a little sip of the old green tea. Potter, the old Potter's here, Potter64, welcome to you. Thanks for being here this evening, as always. Cara, thank you, very kind. Too kind, some would say. Oh no, we're not going on about this again, are we? The old bias stuff. Oh dear. I'll tell you what it is. It's because people hear things and they think, oh, that doesn't sound very good. So then they try and make it out that I'm being biased because in their brain is telling them, hang on, this doesn't sound very good. So I'll blame him for narrating the truth. I'll blame him for narrating the facts. I've got my own opinion, which I do share occasionally, but you know, this channel isn't about my opinion. It's about providing the facts of the case, and you can make of it whatever you will. As I say, I'm covering both the prosecution here, or his evidence in chief, which we're going through now, and then we're going to take a look at the 8 pages of the cross-examination. 9 pages, even, conducted by Benjamin Myers. So if this was like some sort of railroading exercise, or some sort of, you know, biased, some sort of biased situation where I'm just trying to push one specific story, as in the prosecution, then I wouldn't be covering this, would I? I would just simply leave it out. I don't have to cover it, but I want to cover it because it shows both sides of the story, doesn't it? Right, so let's leave that on there. Let's have a look here. HM, welcome to you. Thanks for joining us. Beautifully Fractured, welcome to you. Thanks for joining us. Celeste is in the house. Did I do that all right, did I? That was a bit... See, these words just get thrown at me. I don't read this before I narrate it, so I get caught off guard sometimes. But, yeah, we'll see how we get on with the rest of it. Okay. Like I've said many times, I've got no problem if people believe she's innocent. Everybody's entitled to their own opinion. What I find funny, though, is where you have channels and people creating content who didn't follow the first trial. They're not really offering anything at all in terms of educational value in terms of this case. And yet they're very opinionated. Yet they don't know the facts to be able to have a proper opinion. And then I get the blame because I'm covering both sides of it. That's what I can't understand. Like, I'm just providing you with the facts. If you don't like the facts, if it hurts your brain, or if you don't like how it sounds, then just stick in your cave or your little box and listen to your own rhetoric, I guess is the best way of putting it, because I'm here to produce or provide the actual facts in terms of what happened during Lucy Letby's trial. That's all I'm here to do. What you make of this information is completely and utterly up to you. Right. Where were we? So, page 10, I think it was. So, taken from the samples of the tissue from the lungs, he replies, yes. So, they're in the paraffin block. They're then sliced very thinly. 1 micron, did you say? He replies, 4. It's the width of our hair, 1 hair. 4 microns thick on a slide. He replies, yes. And then put under a microscope. He replies, stained, and then put under a microscope so we can see the structure. What is the purpose of staining in this context? He replies, because there's no other way. Using light that you can see the structures differently, that's the physics of how light and do various things react differently to a stain. He replies, yes. And so by staining the tissue, you in effect produce a contrast between different structures. He replies, yes, that's how you can observe them. This is so thin that if you put a light under it, you can see through it. He replies, yes. What did you see? He says, so in 2 of those sections, and I refer to what sub-numbering they had on the sections I received, I could see occasional, very occasional, relatively large spherical empty spaces or globules. Mr. Johnson, I'm sorry to break this down, but spherical empty spaces or globules, what does that mean? What are you seeing? He replies, so structures that resemble a grape that has been cut through, and you can only see one surface of that cut, so round or roughly round structures. But I see them on 2 dimensions, so a section, not in 3 dimensions. Imagine a grape cutting through it, and that surface you get, looking on it from the top. That's a spherical structure. Mr. Johnson, where did you see those spherical empty spaces or globules? He replies, within the lumens of medium-sized veins. So the lungs. Remember this big, and then he's indicating, this big cut on very thin layers. They have veins and arteries. And the veins, you can tell the difference most of the times within an artery and a vein on the microscopic level. And those veins, imagine tubes, cut through them, you have a ring. So the inside of the ring is called the lumen. In those lumens, in the inside of the ring being the vein, on the inside of the ring, I saw that cut surface that resembled the cut surface of a grape. Mr. Johnson, if we think of a vein as being a tunnel, you're looking down the tunnel from end to end. Yes, that view. And as you look down the tunnel, you see a round object in the tunnel. He replies, yes, but that's 3-dimensional. I'm looking 2 dimensions, so I'm looking at a section like this, indicating of the tunnel. Yes, and what was the significance of what you could see to your trained eye? He replies, those empty spaces, which meant that they stained for neither hematoxylin, which is a substance we use, or Christ, is that eosin? Let me just check. Let me get Google up. Hang on a second. 2 seconds, guys. Got to do this on the fly. Ah, spot on. Eosin. There we go. Right, so those empty spaces, which meant that they stained for neither hematoxylin, which is the substance we use, or eosin, which is the other substance we use, had no colour. They were white. Mr. Johnson, what does blood show up as in a vein if you stain it with hematoxylin or the other substance? He replies, we stain the slide with both hematoxylin and eosin. The blood will look red and you see red blood cells. And you see the other cellular components of the blood. For example, neutrophils, which have they have a bluish multi-lobulated nucleus and a red surrounding. Christ, it's testing me tonight, isn't it? You see lipocytes, which have basically no surrounding, but a very dark, round nucleus. But a very dark, round nucleus. You see the different structures. This was an empty structure, a white structure. And in practice, this can be two things. It can be either air or it can be fat. Okay? Mr. Johnson replies, yes. Fat has a slightly different appearance from... So the empty space we typically see when it's fat, it's different to the grape structure that I have described. It's much smaller. So it's not a grape, it's a small berry, if you compare the sizes that has been cut. It's typically round rather than oval, or spherical, or multilobulated. That could be air. Plus, when we see fat, we always look. When we think it's fat and we see something, a small globule, and we think it's fat, we look for further evidence of fat embolism because that's when you expect to see fat. When do we get fat embolus? We get it when we have a fractured bone. And when we have that, it's because small fragments of the bone will get into the circulation and go into the vessels. When we see fat emboli, we will, with very careful observation, find next to those globules, in other vessels or in capillaries, elements of bone marrow. In this case, I didn't see the globules that I would expect to see if this was fat. Mr. Johnson, so they were not typical of fat globules? He replies, yes. And I did not see the other elements of bone marrow embolism. Plus, we had no fractures that would explain why we had these, and then it says inaudible. So what conclusion did you draw as to... He replies, I need to say something else. Sorry, I beg your pardon. And he continues. So if these blocks were sent to me a decade ago, I would have requested from the lab to undertake a special stain. The single special stain we can on paraffin embedded tissue called osmium stain. That specifically stains fat, and I would have excluded that possibility. However, it's a very toxic substance. Labs don't do it anymore, so we can't do that. What we do nowadays, not being allowed to use the stain anymore, basically, because there are health risks for the lab staff, we take smaller pieces of the tissues of interest. Routinely, we freeze them, and those can be stained with, but it needs to be frozen tissue, which we didn't have here. It needs to be stained with a stain called oil red 0. And that will give us the answer whether indeed it's fat or not. So from what I had, my conclusion was that this would more likely than not, these spaces represent air. Yes. Then he continues. I saw a similar thing in a section from the brain, in that I could see that the lumen was surrounded by blood, which tells me I cannot be 100% sure, I cannot be categoric. It tells me that most likely this bubble of air went there while this baby was alive, because there is a response to that, and the response is the hemorrhage. Mr. Johnson, so in the brain, air in the brain, or gas in the brain? He replies, that's how it looked. And there was a response to the air, which suggested that the air went to the brain in life. Dr. Marnerides replies, yes. However, I need to make it clear to this court and to the jurors that those findings cannot be taken as an absolute proof. Mr. Johnson, yes. Dr. Marnerides, they are in my eyes and my opinion suggestive, highly suggestive, but if I had no other history, no clinical information, no assessment by a clinician, and I only had those two findings, I would have said, I cannot really tell you if it's air there, and it's not an artefact explicable on the decomposition changes and all the artefacts we made. Mr. Johnson, does it come to this, that you cannot say, and you do not say, that your findings necessarily mean that there was an air embolism in this case? He replies, that's correct. Would it be fair to say that one has to look at the other evidence to make that determination, if there is any other evidence? He replies, if there is any evidence, the pathologist needs to take that into account. We need to accept that a post-mortem examination is a snapshot taken after the death of an individual, of the process of somebody dying. So to interrupt the snapshot, sometimes we are able to say without any clinical information, yes, this is what I see, this is what happened. But in many cases, and that's the bread and butter of paediatric pathology, we need the assessment of the course before that snapshot. If that assessment tells me that the findings indicate towards air embolus being the case, my findings would be consistent with that. But my findings on their own would not say, yes, it is. So, Mr. Johnson, we've heard from Professor Arthurs, the radiologist, about gas getting into the circulation after death. Was there any evidence from what was seen at the post-mortem examination, the pathologist's examination, to suggest that decomposition likely played a part in any gas in the bloodstream? He replies, no, there wasn't. It's highly unlikely. Highly unlikely. Why do you say that? Well, I'll come back to that in a second. Celeste has gifted 1 crime scene to courtroom membership. Now, as I say, the next members only live will probably be on Sunday evening, I'd imagine. But if you want access to the members only stream, you can find out how to support the channel or how to become a member down in the video description box below. Feel free to check that out at your leisure. All help and support is greatly, greatly appreciated. Right, okay. I can't believe Leslie still doesn't have a membership. It just seems like a conspiracy, doesn't it? It really does. Right, 2 seconds and we shall continue. Okay, right. Sip the old green tea and we shall carry on. At least it hasn't been that bad with the pronunciations tonight, with some of the words, so that's pretty good. Okay. So we've got 18, 19 and 20. Okay. Right. So he said, no, there wasn't. It's highly unlikely. Highly unlikely. Why do you say that? He replies, because for decomposition to result in air into vessels, you need to have evidence of decomposition. This evidence of decomposition is typically visible to the naked eye. So you see decomposing bowels. You see a greenish discoloration of the abdomen. Most importantly, on histology, so looking under the microscope, the structures look autolyzed. And you can say, yes, there has been significant decomposition here or not. This was not the case here. The other reason is that the brain, there was a response to that finding that wouldn't, the hemorrhage around that vessel. That wouldn't be expected if that was due to decomposition. So although one cannot categorically say it wasn't, I think I would confidently say it's highly unlikely. Mr. Johnson, there's one thing I have overlooked as we've gone through, and that's the issue of a tamponade, which is to do with the long line perforating or agitating against the heart. You deal with this in your report, Dr. Marnerides. Was there any evidence from the findings of the post-mortem examination that that played a part in child A's death? Because that's basically, I think, what the defence are trying to say, that the insertion of that line somehow caused a collapse. So was there any evidence from the findings of the post-mortem examination that that played a part in child A's death? He replies, if there was evidence of tamponade at post-mortem, one would have seen hemorrhage into the sac that surrounds the heart. That's called the pericardium. One would have seen blood there. Dr. Shuckler did not see blood there, and there was no such blood in the photographs. Mr. Johnson, yes. So what Dr. Shuckler recorded as the physical findings and what you have seen from the photographs do not support any suggestion that there was tamponade. He replies, yes, thank you. Can we go to the opinion section, please, of your report, Dr. Marnerides? Was there any evidence of any natural disease in child A that could have contributed to his premature death? He replies, my understanding from the clinical review is that there wasn't. From the pathology review, there is no evidence indicating to a natural disease. So overall, there is, in my opinion, no evidence that a natural disease would explain his death. So looking at the cause of child A's death, what conclusion did you draw, please? He replies, on the basis of the clinical information, the findings that I have explained and the caveats I have explained to this court in relation to how these findings can be interpreted, I took the view that the death would be explicable on the basis of air embolism. Thank you. And the means by which that air embolism came about, did you draw any conclusions from all the information? He replies, from the information, it would appear this injection... No, hang on. From the information, it would appear this is injection. So insertion of air into a vascular access line. Mr. Johnson. My lord, that may be a good moment for a break. Right, so that's the end of that concerning child A. And shortly, we'll take a look at the cross-examination. So let's change the banner. There we go. And catch up with the chat very briefly. Kaz49, I was going to say 249 then for some reason, with the £2 super sticker. Much appreciated. Thank you for your support. And also, I got an email, didn't I, from the Burglar King with the $5 Buy Me a Coffee. Thank you very much for your continued support, as always. Oh, Burglar's just gone by the looks of it. She may have missed it. Hopefully not. Totem Crow, welcome. Essex True Crime has just got out of bed at 8:45 in the evening. Nice of you to join us so late in the show. Welcome, welcome. Yeah, there is someone called the Burglar King, isn't there? Well, it said on there, hang on a second, I'm not losing my marbles. It said Carol, aka Burglar King, just supported you with $5. So she does exist. But I think she's gone now. She's gone to rest, says JB. Oh, really? Really, Celeste? Like I say, when I'm reading this stuff out, I can't follow the chat, so I miss so much stuff that goes on in the chat. So, yeah, sending my best, kindest wishes to Burglar King, or Carol, as she's also known. Hope you get better soon. Hope you feel better and have a good sleep or a good rest, as it were. Essex True Crime. Yeah, that's crazy, isn't it? Yeah, sending you all my best, Carol. As I say, have a nice rest and some nice rest and relaxation this evening, if you possibly can. And you can sit here and listen to my dulcet tones. Right, okay. Right, just give me a second and we shall continue with the cross-examination of Dr. Marnerides conducted by Benjamin Myers KC on behalf of Lucy Letby. Just give me a second. Okay. Right, so Mr. Myers' cross-examination of Dr. Marnerides. So, I'm going to turn next to child A. These are technical questions, but I will repeat what I have said before. There is no insensitivity or lack of sympathy to the position of those involved in this with the questions that I will ask. The same applies with all witnesses in this case as well. It sounds a little bit objective, but it's not meant to be insensitive when I ask the questions. Yesterday, Dr. Marnerides, you went into some detail at one point about what may be fat globules or bubbles of air in some of the samples you saw. He replies, yes. But to be clear about it, the pathology does not prove air embolus in this case, does it? Let's just read that again. But to be clear about it, the pathology does not prove air embolus in this case, does it? He replies, that's correct. Looking at the report you wrote on the 21st of January 2019, Dr. Marnerides, I'm looking at, it says page 12 of 13. Do your pages have numbers at the top right-hand corner? He replies, yes. It's your opinion, paragraph B, in your report dated the 21st of January 2019. He replies, yes. And in fact, having reviewed the items you told us yesterday about items in the lungs or in the brain, you conclude that by saying, it is therefore my opinion that from the post-mortem examination point of view, the death of baby A remains unascertained. That's what you say, isn't it? He replies, yes, strictly from the post-mortem. Yes, again, what I'm keen to do is to go where we can. What I'm keen to do is to go where we can get to on the pathology. And he says, sorry, pause. Where we can get to on the pathology, and then to see the part played by other experts and their opinions. From the post-mortem point of view, it is unascertained. And your opinion, Dr. Marnerides, is that purely from the histology and the morphology? We're used to those expressions now. There is no evidence that death was due to unnatural causes at all, just looking at the morphology and the histopathology. Cool, they're really testing me tonight. He replies, can you read what I exactly wrote? Mr. Myers says, yes, of course, if we look at your paragraph B. Having reviewed the post-mortem examination findings and the related ancillary post-mortem investigations and histology, I could not identify any convincing positive morphological evidence indicating that the death of child A was due to unnatural causes. Do you see that? He replies, yes, that's what I said. I'm not sure that what you asked me to comment on was exactly this. Mr. Myers replies, first of all, there is no positive morphological evidence that it was unnatural, is there? He replies, yes. You agree, don't you? He replies, well, I wrote it. Yes, you did. And likewise, there was no histopathology. There was no histopathology that indicated unnatural cause. I'm asking you that as a general question, Dr. Marnerides. He replies, did you say natural or unnatural? Indicating it was an unnatural cause, establishing that. He replies, I said yes, there was no convincing positive morphological evidence. I was also adding histopathological evidence as well. I'm asking you about that. He replies, the term morphological includes both naked eye and histo. He replies, sorry, Mr. Myers replies, we have that, that's clear, that's what I wanted to confirm. So far as pathology takes us, the pathology on its own, that doesn't take us to air embolus, does it, on its own? He replies, on its own, yes. Which is why you settled on the expression, the death is unascertained on the pathology. He replies, on its own, yes. What you go on to do, and you say it in your paragraph C, you then turn to look at what you call, quote, the constellation of the circumstantial and clinical evidence in this instance as outlined. I'm looking in particular at Dr. Evans' statement, and that's your paragraph C. That's right, isn't it? You looked at the other material. He replies, correct. And therefore, because you come to the point that this could be air embolus, And therefore, because you come to the point that this could be air embolus, don't you? Ultimately, in the light of that, you take the view this could be explained by air embolus. He replies, yes, this would be explained by air embolus. And you get to that point by moving beyond the pathology, but in effect factoring in what the clinicians say about the circumstances leading up to and at the time of death. Is that right? He replies, yes, may I make a comment on that? So that's what pathology is about. When we were asked to offer an opinion on the cause of death, I will give you an example that I will... Hang on a second, is that right? So that's what pathology is about, when we're asked to offer an opinion on the cause of death. I will give you an example that I think will explain to the jury how a pathologist will take into account the investigations and the opinions of clinicians. We have a dead baby, not one of those that we are discussing here. And there is no known medical history. There is no known assessment by any clinician before the baby is found dead. I do the post-mortem examination. I do my ancillary investigations. And I do genetic testing. I take all the results and microbiology, virology, everything comes back negative. And the cause of death at the end is, from the pathology point of view, unascertained. And we have the family. Because of that happens very often, the family refer to that to a review by a clinical genetist. Geneticist, looking into details for genetic reasons, and they do further testing, not on the samples from the baby, but on the samples from the parents and the siblings. The findings say that is unlikely. The findings say that is likely because they have findings from the family that the baby that died. Right, some of this writing's not spaced out properly. The findings say that is likely because they have findings from the family that the baby that died due to cardiac arrhythmia, which cannot be seen on morphology. And this is a known syndrome. Let's say DiGeorge, is that right? Bring up Google, hang on a second. Two seconds. DiGeorge, right, okay, DiGeorge syndrome. Okay, so the findings say that is likely because they have findings from the family that the baby that died due to cardiac arrhythmia, which cannot be seen on morphology. And this is a known syndrome, let's say DiGeorge syndrome, that has no morphological findings at post-mortem examination. When I receive that information, I will issue a supplementary report as a pathologist, saying, quote, in face of the new evidence, although there is no proof on the baby, the likely cause of this dead baby is DiGeorge syndrome. This is what happens in all cases, basically. Mr. Myers. Yes, because where the pathology is neutral, you can then take into account the assessments or additional evidence, for example, from the clinicians or the radiology. That's correct, isn't it? He replies, yes. And of course, at that point, unless the pathology directly contradicts what, for instance, Dr. Evans says, you are relying upon the assessment that he provides you with, aren't you? He replies, not Dr. Evans only, the other clinicians. All the clinicians, but Dr. Evans features in your reports principally, doesn't he? He replies, the initial reports, because that was the first clinical assessment they had. Mr. Myers. So, for example, as I asked earlier, the suggestion that a baby is doing well up to the time of collapse, if you receive that suggestion, that is something that you'd accept unless you find something on the pathology to challenge that. He replies, yes. Mr. Myers. Right, just whilst we're dealing with child A, although it's not on the issue of air embolus, we heard the agreed facts yesterday, Dr. Marnerides, which included this. It was agreed fact 20. I'm going to read it out. It's from the end of that agreed fact where it says, Dr. Schuckler observed that there is a strong temporal relationship between the long line insertion and patient's apneic spell and collapse. Long line positions could not be confirmed at autopsy as it was removed during life. So working backwards from what we have there, so far as the long line that was inserted at some time just before or around 1900 hours is concerned, that was not in situ at the time of death. It had been removed, hadn't it? He replies, it could have been removed after death. Well, in fact, we know from the clinical records and from the evidence when it was removed. So far as all you know is that it wasn't there when child A went to autopsy. Dr. Marnerides replies, all I know is that Dr. Schuckler didn't see it. Mr. Myers, Dr. Schuckler commented on the strong temporal relationship between the long line insertion and the patient's apneic spell. Is it the case that a long line may induce an arrhythmia if it comes into contact with the heart or the surface of the heart? He replies, you're asking me to comment on a comment that somebody else made and on something that has clinical experts to answer. Mr. Myers, well, you have certainly at the point of incorporating it within your evidence, in effect commented, have you not, on the quality of the clinical assessments you've received? He replies, so if the clinical evidence is that the insertion of a line could induce arrhythmia, and it could induce arrhythmia resulting to death, if there is such evidence, the pathology cannot refute it. Mr. Myers, right, so first of all, in terms of the general mechanism of a long line inducing arrhythmia in general, is that something you're able to comment on, or is it not? I'm not being critical, I just want to know, Dr. Marnerides. He replies, I don't want to comment on general things. Alright, and in this case, then it says overspeaking. I serve any purpose commenting on general things. So I don't know what that part is missed out there. Mr. Myers, well, you've been asked to assist us with the fact that, as a general principle, a diaphragm could be splintered by excessive air, haven't you? He replies, yes, because I make a comment on that in my report, that's why. There are points where I may have to ask you things outside your reports for your expertise to assist us. He replies, if I can, I will. Right, but when it comes to the question of a long line and arrhythmia, as a general principle, is that anything you can assist us with or not? He replies, the general knowledge I have is that it can induce arrhythmia. But I make it plain for your benefit. You don't speak that as an expert. You are just conceding that in general knowledge. He replies, yes. There is one other matter I'd like to ask you about child A before we move on from child A. Again, it comes from material we looked at in the agreed facts yesterday. We've seen the finding that child A's lungs were severely congested and... hang on a second. I've got this word ready. Hang on. Hemorrhagic. Right. Were severely congested and hemorrhagic. That's a finding from Dr. Schuckler from the post-mortem. Can you assist us, and again please say if you can't, as to whether or not what's called pulmonary hypertension can lead to that happening or not? He replies, this finding of congestion and hemorrhage in the lungs is so common that it could be a never-ending list of conditions that it could be associated with. In terms of pulmonary hypertension, for a pathologist to confirm the pressure of pulmonary hypertension, there are features on histology we can see, but it has to have been there for some time. Mr. Myers, all right. So that's as far as we can go on that, says Mr. Marnerides, Dr. Marnerides. Mr. Myers, so in child A's case, because he was only 24 hours old at the time he died, it's not long enough for any chronic feature to establish itself. Dr. Marnerides replies, yes, that's correct. And then the judge asks a question. Can I be clear, are you saying in child A's case you can exclude that then or not? He replies, no, the clinicians would be in a better position to exclude whether there was a clinical evidence of pulmonary hypertension. From the pathology point of view, I don't have features to say that. Yes, he had pulmonary hypertension. But because he's so young, I wouldn't, even if he had pulmonary hypertension, I wouldn't expect to be able to see it because there's not enough time to develop. The judge, because he hadn't lived long enough. He replies, yes. Then the judge, I just wanted to be clear where you were. Sorry, Mr. Myers, I just wanted to be clear in my mind. So, Mr. Myers, I'm going to turn to child C. Right, so that's the end of the cross-examination. Crooked halo with the £10 super sticker.
Oh my God!
That is very kind. Thank you very much. Right, okay, let's catch up with a chat very briefly. Oh, is there another press conference, is there, by Old MacDonald? When's that going to take place then? Let's have a look here. North Valor. Where is that exactly? North Valor. Do tell us, Joanna. I've got no idea what that is. Right, okay. Histology looks at little pieces of tissue. Yeah, Joanna knows what she's on about. A lot more than I do, anyway, that's for sure. Especially when you then come across that that word, what was it? Hemorrhagic and jurisprudence. Yes, right, okay. So I think basically, to summarise, and again, this is just my opinion here, my non-medical opinion, but it appears that what Dr. Marnerides is saying here is that he's taking all of the information into account. He's not just looking at one aspect, he's taking the findings that he has in front of him and also the evidence given by the clinicians who were also there at the time, who are surrounding the child at the time of death, and also the reports made by the other individuals concerned in this case, or the other experts' opinions, basically, before he's making his final finding. That's what I gather from that anyway. And I think what Mr. Myers is trying to get him to say, particularly at the beginning, is that, well, you know, you've said here it's unascertained. And he's talking about, well, looking at it in this specific context, it's unascertained. But taking on board the other evidence changes my opinion because of X, Y, and Z. I think that's basically what he's getting at. It's almost like, you know, you've got to remember that air embolism doesn't just show one specific sign. It's not like, okay, if you've got just the discoloration, then that has to be air embolism. He's taking all of the information into account before making his assessment. That's the way I read it anyway. Let's have a look here. And like I say, probably tomorrow. What's tomorrow? Saturday, isn't it? Yeah, we'll continue with the case of child B, and we'll do the same. We'll take a look at Dr. Marnerides. No, it's not child B, sorry. It's only the death. So it's child C, which we'll be taking a look at tomorrow. And we'll go through Dr. Marnerides' evidence, his evidence in chief, and then also the cross-examination conducted by Benjamin Myers KC. Right, okay. Let's just make sure I haven't missed anything. I'll catch up with you guys very quickly before we finish this evening. Yeah, well, like I say, the transcripts give you the full picture. The live reporting that many people heard during the trial itself is only like a snapshot. I mean, the live reporting probably caught about, 30% of what was actually said? So that's the benefit of having the actual transcripts, because you can read word for word the entirety of what took place, not just the snapshot, you know? And as I say, this is the first time that I'm reading this. I literally copy it onto a Word document, I space it out so it's a bit easier to read, I colour coordinate the answers or put them in yellow, whatever, and then I literally upload it onto here, and then I'm reading it as I'm going along, basically. So I'm reading it at the same time as you are, pretty much. I mean, when you think about all the stuff that Dr. Marnerides had, I mean, let's go back to that part a minute. I mean, these experts haven't got this. This is what makes me laugh about, oh, we've got 50 experts. Well, your 50 experts haven't got the medical records. They haven't got the medical reports. They haven't got the slides. They haven't got... Let's just see how much stuff that Dr. Marnerides was provided with to actually give his opinion. And we're not talking about a couple of experts who have just read the live reporting from the Cheshire standard or whatever. We're talking about someone who's actually seen the medical records, you know what I mean? The medical records of these children, which they won't give some certain stuff. I don't know exactly what it is, but they won't allow the defence to have access to certain things for their new experts or something or other. But I think that's actually in relation to Dr. Evans' new report, if that even exists. But where was that part with Dr. Marnerides and what he was actually provided with in order to make his assessment? Because the experts in this case, or the new defence experts, have not got the medical records. So it makes you wonder, what exactly do they have? Because Dr. Marnerides, he's got a 331-page PDF document, which was in effect medical records from the Countess of Chester Hospital. What else did he have? He had material that he received from the police, material from Dr. Evans, 331 pages of medical records relating to child A. And then he had quite a lot of photographs that were taken by the pathologist Dr. Shuckler at the post-mortem examination. They won't have those. A list of photographs can be provided, but in essence, were you given or shown the photographs that Dr. Shuckler took at that examination? Yes. Did you also receive 78 pages of paperwork relating to Dr. Shuckler's examination? Yes. The coroner's records, which ran to 100 pages? Yes. And also the 25 histology slides that have been compiled consequent on the initial post-mortem examination? Yes. Together with 23 paraffin blocks? Yes. Now, I don't think for a minute that the experts who are now coming out with an opinion on some of these cases have any of that information. They don't have any of that information. That's why I don't put much faith in it, to be perfectly honest, because they don't have the information the original pathologist had. They don't have the information or the evidence that the other experts have seen, even the defence experts. So that's why I'm not sitting here saying, oh my God, Lucy Letby is going to be exonerated, because really, the people who are making that assertion haven't seen the evidence. They haven't seen the evidence. So, yeah, there we go. I know, well, they haven't submitted anything, have they? They haven't submitted anything, to the best of my knowledge, to the CCRC, despite saying they were doing it immediately. It hasn't happened, I don't believe. I might be wrong, but I don't think so. Right, okay. So as I say, tomorrow we're going to take a look at the case of Child C. We do exactly the same as we did today. We'll play a video giving a little bit of context concerning that particular case. And then we'll take a look at Dr. Marnerides' evidence in chief concerning Child C, and then his cross-examination conducted by Benjamin Myers. Again, thank you to everybody who has supported this evening. Euphemia. I keep going to say Euphemia, but it's Euphemia Grub. Valor Hawks. Lenny Russell with the kind 10 gifted memberships. Anya, I believe that's how you pronounce it, is a new member. Thank you very much for that. Celeste. Jill Pendleton. I'm sure I missed that one out. Jill Pendleton gifted 1 Crime Scene to Courtroom membership. Greatly appreciated, Jill. Kaz49 with the £2 super sticker. And Crooked Halo with the £10 super chat. Thank you to the moderators, Lenny Russell, JB, Valorhawks, and the legend that is Terence Stamper. Thank you for your work and your help this evening, and for each of yours attendance and your viewing. Thank you very much. Silver Fox. Yeah, the next one will be tomorrow, I'd imagine, at 7:30. So yeah, you shouldn't miss that one, hopefully. And the next members only stream will be probably 6 o'clock on Sunday, but I'll put out an announcement regarding that at a later date. Anyway, many thanks for joining me this evening, and I will see you all tomorrow at the same time. And on this occasion, I've actually got the outro video, so bear with me, and I'll see you all again. Oh, hang on a second. Nope, I can't go yet. JB with the $10 Australian, I believe that is. Thank you very much. That's incredibly kind. Right. Thank you for your viewing this evening, or thank you for viewing this evening and joining me on this live stream. And I'll see you all tomorrow at 7:30. Have a great evening. Enjoy the rest of your night, and I'll see you very soon. Goodbye.